All right. Assalamu alaikum, everyone, once again, and a very good evening to all of you. My name is Eeman Ahmad, and I'm a third-year medical student here at the FMH College of Medicine. Welcome to From Applicants to Residents, a webinar organized by CHSR FMH, Center for Health Sciences Research. In this webinar, as the name suggests, our four distinguished panelists will be covering their journey from applicants to residents, how they undertook that journey and successfully matched in residency programs in the US. Our panelists include four graduates of the FMH College of Medicine. Firstly, we have Dr. Abbas Malik, who is a graduate of FMH from the class of 2021, and he is an incoming resident in internal medicine at the Brooklyn Hospital Center, New York. Secondly, we have Dr. Khurram Arshad, who is a graduate of the class of 2016 from FMH. He is also an internal medicine resident. He is currently on call, but will be joining us as soon as he is free. Thirdly, we have Dr. Muhammad Aadil. Dr. Aadil is currently a fellow in addiction psychiatry at the Yale School of Medicine. He is interested in drug policy reforms, addiction, and harm reduction. He is a graduate of FMH from the class of 2013, after which he went on to complete his psychiatry residency at Rutgers, New Jersey Medical School. He will be joining the psychiatry team at Jacobi Medical Center in New York as an outpatient psychiatrist this year. And last but not least, we have Dr. Mariam Tariq Awana, who was kind enough to organize this webinar and reach out to all of the panelists as well. She is also an incoming resident this year and is a graduate of FMH from the class of 2018. She graduated in March 2019 and also did her house job from FMH. During her time at FMH, she was the president of the Debating Society, was also on the management team of the Sports Club and the Dramatic Society, and most notably, she was the pioneer and the president of the Humans of FMH Society. So without further ado, we will be starting with the webinar where we will be covering various aspects of the journey to applying to the US, including the exams that you have to take, the improvements that you can make to your CV, the activities that you can do during med school and after med school. So I will be opening the floor to the panelists. I think we can start with Dr. Mariam. Dr. Mariam, you can unmute yourself. Yeah.
Okay. Assalamu alaikum, everyone. And it's really good to see so many people around who are interested in USMLE. And I know most of you are in med school right now, and my journey was a bit different because I began my journey after graduating. So after I did my house job, then I decided to do USMLE, but had a few background towards it. Right now, I'm incoming PGY1 in internal medicine and pediatrics combined. That's one of the combined programs of residency that you're going to do. And I will be coming as incoming PGY1 in East Carolina University in North Carolina. So before I start my journey, I wanted the floor to be given to Dr. Abbas because he is the fresh graduate and he did most of the journey during the med school and how he prepared. He could be a more like a person to talk about in depth about his journey during med school and what resources he used. And then I will talk about my journey and Dr. Aadil can also talk about his journey later on. So let's go to Dr. Abbas before me.
Hi, thank you so much for that introduction, Dr. Mariam, and thank you for organizing this, Eeman, Dr. Mariam, everyone else. Really happy to be here. Yeah, I started just an overview about myself. I decided to pursue the USMLE in my third year of medical school. I was surrounded by a lot of friends, foreign students from the US. So they kind of pushed me to go towards that so that I could join them over there in the US. And I basically planned all my resources and what to use and what basically use a lot of blogs and resources just to get an overview of how to go about this whole process. And I just started studying during my fourth year of medical school for the USMLE Step 1 exam. Let me share my screen with you guys so that I can be a bit better. Can everyone see this?
No, we cannot talk in Abbas.
Sorry, let me just. What about now? Can everyone see this?
Yes, we can see it now.
Okay, so I just want to go through like what an ideal timeline would look like for international medical graduates. I mean, first of all, I just want to start off by saying that, breathe, just don't worry about this too much. This is just something that I personally recommend, which would be ideal for everyone. So what I would recommend is that you start looking into resources in terms of books, learning resources, obviously financial resources, and all of that stuff by approximately by middle of third year. I wouldn't recommend starting any sooner than that. Third year is, it was one of my favorite years because I really enjoyed pharmacology and microbiology and all that. And a lot of that is very essential for the clinical side and for step 1 and all the exams later on. So I wouldn't recommend to start preparing during your third year. I would just recommend focusing on your third year professional exams and just building a solid foundation, because a lot of the subjects covered during that time are very essential throughout your clinical career. I recommend before, if you want to be more proactive, I would recommend focusing more on finding research opportunities and building on research skills before your third year. I'm sure the other panelists can speak more about that. So yeah, I recommend that you gather all the resources, books, and your courage or himmat by the time third year ends, because this is, I don't want to scare anyone, but it's the start of a long journey ahead. Ideally, I would recommend, just as I did, to start your USMLE Step 1 prep by beginning of fourth year. When I was preparing for my Step 1, it was actually a scored exam, and with all the blogs that I read, that also kind of scared me about how IMGs need to score very high to get into residency. I decided to give the exam as soon as possible so that I can have a scored, so that I can have a 3-digit score. So I would recommend just gathering your resources as I recommended during third year. And ideally, you should be able to give the pass-fail exam approximately by within 4 to 6 months. Again, this depends on everyone, and everyone has an individualized way of going by exams, but I wouldn't recommend going preparing for longer than that, because that might lead to other issues such as burnout, and it might not be the most efficient way to go. So I would recommend just booking your exam for 6 months ahead of time, and not really changing the date, because sometimes it's pretty natural to get jitters near the end, but I would really recommend to just book the exam beforehand and just aim towards that date. After that, I would recommend just hopefully, if you're done with step 1 by the middle or towards the end of fourth year, just focus on your fourth year prof. Again, I went through the same thing, and sometimes it does get overwhelming to prepare for prof and for your step exams at the same time, but honestly, if I can do it, so can you guys, and I'm sure you guys will get it done. After your fourth year prof, I would, just take a break, a bit of a break for yourself. Congratulate yourself on getting done with step one. That's a huge achievement on its own. After that, I would really recommend that you when final year starts, you should be looking into gathering your step 2 CK resources and working towards that to give your step 2 before your final prof. My timeline was a bit different. I had some issues come in, some personal issues due to which I couldn't give it before my final prof. So I decided to, sorry. So I decided to give it as soon as I got done with final year. And the reason for that is pretty important. I really recommend that everyone, you get done with all your exams that are required to apply for residency, especially for a J1 visa status. And then after you're done with final year, you can just, allocate all your resources towards going to the US and gathering more clinical experience or research experience so that you can further sharpen your resume for the match. And hopefully you have all your letters of recommendation by the time math starts in September. Now I'm just going to talk a bit about resources. Over these past, I started my journey in 2020, and this is pretty much, these are the resources that were going around during that time. And first of all, let's just talk about the gold standard stuff. And these are pretty much in order. I would, the best resource for all your exams, I personally think, is practicing as many questions as you possibly can. And the best question bank out there is hands down UWorld. I'm sure most of the panelists would agree. Again, and a tip about this is that sometimes people get started with the UWorld and they get anxious with their scores early on, and they feel like they're not performing well enough. One of the biggest things that that everyone needs to understand is that UWorld is a learning tool, especially during the first time around. Again, this is a completely different ball game preparing for such a lengthy and conceptual exam. It's completely different from what we've learned during med school preparing for professional exams. So give yourself some time to get adjusted to doing the Q bank, and just always remember that the initial scores are always low for everyone, and it's essentially a learning tool in the beginning. The second resource I really want to talk about is the First Aid Step 1. It is the most important book that you'll buy, I feel, for all your step exams. I think this is the only book that really matters, the physical book. These two resources, I feel like you cannot really give the exam without, but again, everyone is different. Step 1 is a first aid Step 1 is a complete resource, and it gives you all the high yield points for board exams from Step 1 to Step 3. So I really recommend buying a nice fresh copy of that and annotating it, or maybe not even annotating it as you go, whatever suits you best. Another resource I really want to talk about is Pathoma. A lot of you in fourth year might already know about this, but Pathoma is a great resource which really focuses again on the high yield stuff rather than all the minute details that we used to, I guess, memorize during med school. So again, people who are preparing for Step 1 during fourth year, they might get overwhelmed with special pathology, and it's completely understandable. I was too at that time, but I really think that Pathoma did a great job to cover all the essential points needed for in terms of special pathology and general pathology for the exam. So I really recommend getting that book as well. Boards and Beyond is the next resource I want to talk about, and this is something that really helped me because I'm someone who also enjoys learning by watching videos, and Boards and Beyond is an amazing resource if you really learn well from video sources. It's usually an approximately like a 20 to 30-minute video, and it covers the topics really well, and it really helps you simplify all the concepts that you might need for the exams. Sketchy Micro is another great resource. This is specifically for microbiology. Again, third year peeps out there might know about this. It's a great resource, and it really helps you memorize all the small details about all the bugs out there and all the viruses and whatnot. And I know for some people it's not enjoyable, so I would really recommend going through Sketchy Micro for that. Again, as I started about the gold standard, the next resource I really recommend is the NBMEs and the CMS forms for step 2. So the NBMEs are basically your practice exams. These are some things that you usually give towards the end of your dedicated period, where you kind of start to think about giving the exam, and you want to see how much you're scoring on practice exams. So I would really recommend going through a few of these, if not all, and reviewing them properly before the exam, because a lot of the exam is derived from the stuff mentioned on NBMEs and on UWorld. And I really recommend going through as much of these as possible. Again, these are practice questions, and the biggest thing that you guys need to take away from this is to score as high as possible on an exam. I would my best learning strategy that worked for me is to do as many questions as possible for before going into the exam. So really focus on doing as many practice exams as you can. The CMS forms are is an abbreviation for Clinical Mastery Series, and they basically cover the subject specific forms for step 2. These are divided again on subjects, so internal medicine, obstetrics and gynecology, pediatric surgery, psychiatry, and emergency medicine. And again, these are also derived by the people who write the exam. So I would really recommend going through these before you sit for your step 2 CK exam. These are the gold standard resources. Before I get into the additional resources, I just want to say that this is just, again, this is a very exhaustive list of all the resources that I consulted. I did not go through all of these to score well on my exam. I really recommend just sticking to as few resources as possible, as long as they get the point across, as long as you understand the concept behind everything, and make sure you're not, I would really recommend to make sure you're not really memorizing the conceptual stuff, because a lot of this exam is based on how you apply to clinical situations rather than just pure memorization. So again, additional resources, these are some things that you don't really need to do, but you can supplement in your preparation time. This is the first one is Abbas. Abbas is something which is similar to UWorld. It's a question bank, but again, it's a secondary question bank. If you want to supplement it with UWorld, then sure. But your first and foremost priority should be UWorld and the NBMEs. Abbas is a great resource, but again, as I said, UWorld is the gold standard. Anki is something that a lot of students use, more specifically in the US, the medical students in the US. These are basically digital flashcards that can really help you memorize the nitty-gritty stuff and the details. I wouldn't, again, this is all about consistency, because Anki is something that you need to stay consistent with, otherwise you lose it. So I would really recommend, if you think that you are someone of, if you're the person who really excels on flashcards, then I would really recommend going to getting Anki decks and just going through these before your exams, throughout your prep. Sorry, not just right before exams, but throughout your prep. You need to stay consistent with the Anki. Divine intervention podcasts are, again, something that I use because I like to listen to podcasts while walking or while jogging and stuff. But again, it really depends on if you are someone who can really retain that information. It's completely fine if you don't use this. All of these, as I said, are additional resources. So it's completely up to you guys. Sketchy Pharma and Sketchy Patho are the same as Sketchy Micro. They, you guys might know, they make cartoons out of things, and that kind of helps you memorize. These are video series, so whoever wants to pursue them, they should look into these, more specifically for Pharma and Patho. Kaplan is something that I want to talk about a bit more in detail with, because when I was researching and gathering all the resources for my USMLE exams, a lot of people recommended Kaplan video series and Kaplan books. Again, it might have worked for you guys. It might have worked for those people that recommended it, but it really did not work for me. And I spent almost 2 to 3 weeks trying to get through as much Kaplan as possible, but I realized that I wasn't really retaining as much, since the video lectures are very lengthy. I would really recommend instead of Kaplan, going through Boards and Beyond, because they are more concise and they are more digestible in terms of content. So I would really recommend not to go through Kaplan unless you're someone who can sit through long lectures. And after that, there are YouTube channels which you can consult. I used this Dr. High Yield, which is someone who covers step two information. They summarize a lot of the, as the name suggests, high yield stuff, and it's not that long. It usually covers the whole subject, such as internal medicine, surgery, pediatrics, neurology, gynecology, and all of that stuff within an hour or so, with all the bullet-sized points that you need right before the exam. So these are pretty much all the resources that I consulted. At the end of the day, this is a very, very, very exhaustive list. You do not have to go through all of these resources to get a good score on your exam. The best way to increase your score is to properly go through UWorld as a learning tool initially, and just go through the explanations, no matter how long it takes. Just make sure you drill down those concepts early on in your prep, so that you can exceed. You can succeed at the end. This is a very again, I keep saying, I just want to really drill this down. You guys don't have to use all these resources. At the end of the day, what I realized after my step one was that I did use a lot of resources, and I do not recommend that. You are, by the end of the time, you're all over the place looking for things. So I would just recommend, starting off with the gold standard stuff. Usually UWorld and first aid step one are the non-negotiables. You cannot go through the exam without those, I personally think. And then you should think about a video series such as Boards and Beyond for step one. and at the end you can do your practice exams.
Dr. Abbas,
So
I have a quick question.
yeah, sorry
So
about that.
how did, like, I think most of the people would be wondering, how did you manage your fourth year and also your USMLE? What was your working, like, how many hours did you work on those resources, and how did you manage all of the stuff? So a bit touch on that too.
Yeah, sure. Sorry about that. I was droning on a bit about all the resources, but I again, I mean, I don't want to say I got a bit of a break, but what happened was it was also during the COVID time where we did have a few 2 to 3 months off with school. Again, we had a lot of assignments and stuff, so uh, it wasn't completely off. But I would, even if you are currently in fourth year and you might think that it's impossible to do, uh, again, it's all about your time management. I made a non-negotiable rule with myself that I was going to give at least 2 to 3 hours every day in the beginning towards my USMLE preparation, and the rest of the time I would cover, going through Robins and all the school stuff that I needed to do every day, community medicine, and all that. But even when school started, uh, I knew that I always put this on the forefront until I got near the prof. But Alhamdulillah, I got through the prof and I got through the step exam. It's just I feel like it has a lot to do with your own how much you want it. Again, this is something that I made some rules with myself that I really want to uh, give this exam by the end of the year. And a good way to do that is to really schedule your exam, and just, once you have that deadline in your head, you start to kind of realize that, okay, like it's getting real now, and you really need to like put your foot down and keep going towards that. But I really think that once according to the timeline that I suggested, I really feel that it also really helped me clear my fourth professional as well, because a lot of the stuff that I studied during my USMLE Step 1 preparation, a lot of that really carried over to my fourth year and my fifth year professional exams. And I feel like I would not have changed a single thing about my preparation. Special pathology is one of the main subjects of fourth year, and I feel like I covered it really well. I understood all the concepts that were needed. Uh, and by the time it was prof time, it was really easy for me to get through that specific subject. Even ophthalmology and ear, nose, throat, I try to do a topic a day from those. And again, those weren't really the problematic subjects for me. The only thing that was a bit challenging for me was community medicine. But again, it's just, I feel like the main takeaway is that you need to, there's a bit of self-discipline that comes in, and there's some rules that you need to make with yourself about how to, uh, just giving time in terms of a few hours a day. And I would really also recommend that if you feel like you are pushing yourself too hard, it's always good to, take a step back and take a break and just, relax yourself for a bit, um, because this is a very long journey, and it can take a lot out of you, but you need to learn how to balance that. And I
Okay.
think that's what worked
That's
for
a
me.
very, very valid point. And I would second that, because I've been through this whole journey myself. And it's really, really hard on yourself at times when you feel defeated, or you feel like, oh, how can I do that? How can I achieve it? How can I do that? So there are like so many questions that's come up in your mind. So there was a question, how many months before our planned test date should we start UWorld? And then there's another question, like what is the timeline for step 2 CK? How many months does it usually take? And what do you think is the right time to put down prior to the exam? I could
Okay.
talk about one question and you can talk about all the other stuff.
Yeah,
So
sure. Go ahead.
step 2 CK preparation, I would talk about myself. Like I did my step 1 preparation over the period of almost 10 to 11 months. And step 2 CK was given within 7 months. So 11 months for step 1 because I was doing, I was starting from scratch. I had done my house job. I had already forgotten everything that was in the med school. I didn't remember anything. I wasn't a very star student or something in terms of academics, but I tried to revamp myself. So got familiarized with USMLE step 1, use similar resources to Dr. Abbas. But I would just reiterate that step 2 CK should be within 7 to 8 months or 6 months of your step 1, because that is important. Everybody would agree to it because most of the concept in step 1 would be tested in step 2, but only the extra stuff will be the management stuff. So you need to familiarize yourself with those stuff, and you do not need to spend a lot of time for CK. If you do, then you will come out with burnout. Probably, maybe people take like 1 year at max for CK, but I do not recommend that because I think the ideal timeline should be like preparing for your CK, doing your rotations, and going for your match cycle. I haven't heard about Levinson, that's what said about micro, I think.
Yeah, I just I'll take this one. I mean, what about Levinson for micro? If you are really good at Levinson, this is I just want to cover this by saying that this might be a good book for your professional exams, but again, this is too lengthy of a book to be covered for your step 1 exam. So again, thing is, sure, you need to work hard, but you also need to work smart. You can't go through like Katzung and Guyton and all of those Grey's Anatomy and all those big books because that will be too daunting for you. If you think that you have a very clear picture with the Levinson and that helps you in micro, sure, go ahead. But at the same time, I would really recommend to stick to the concise resources and the high yield resources, especially near the exam, such as first aid and UWord, because they really provide a clear picture of what's going to be on the exam rather than all the nitty gritty detail that's in the 700-page micro Levinson textbook.
Oh, Levinson is that book that we used to study for micro. Oh,
yeah,
I used to use all those 50, 60 pages that were at the end of Levinson for my exam, my prof exam, because I found those more interesting than all the details ones. Yes, I did go through the whole Levinson during my med school. Like whenever the lectures were delivered, I would go through like daily basis. That was one good thing that I did in my med school, was that going through all the lectures daily rather than ending up on the weekend and revising everything. I would do daily thing. People used to call me crazy, but because I did not like, but I didn't like going on weekends over all of the weekly thing that you used to do. So a lot of talk about our resources and stuff. We'll switch to Dr. Aadil now. We'll talk about research and its importance during med school. And Dr. Aadil journey. He is very kind enough. He's one of my mentors too, because he's always there for FMHites and especially for me. And he's one of the mentors who reviewed my CV, reviewed my PS, and also like it said, oh, you'll be okay. This is very much important for the whole journey, to know that you'll be okay, you'll be at the end of the side of the journey, and you'll be happy at one point in time. Whatever you want to achieve, you can. So you should be like, the whole point of organizing this webinar and getting to know you all is that there should be a way for our community in FMH or all the other medical schools where the USMLE is not that much of a hype or something. People do not do it most often. That there should be a community that should be helping each other should be building each other. There was nobody for us at that time. Like Abbas didn't mention any senior he talked about for resources or something. Probably he would have talked to a few people. And I didn't have a lot of people at my back. Also in my step one journey, I was quite lonely at that time. So yes, building up a community, you guys can have your group and you can have your like group study sessions or stuff like that you can achieve your goals more efficiently. So that's the whole point of this whole webinar, to acclimatize with you the whole situation. So Dr. Aadil, tell us about your journey, your bit time at FMH. How did you start your journey about USMLE and how you reached Yale? So yeah.
Yeah, thank you. Thank you for the kind words, and thank you everyone for joining me. I see there's a lot of crowd here. So I'm thinking I won't take long, but I'm gonna talk about three stuff. One is briefly a bit about my journey, and then I will talk a bit about the mistakes that I made during that journey, and finally I want to also touch base why I choose psychiatry and what should you think about in terms of which specialty is best for you. So going back in time, I joined Wa Medical College. I started my med school there, and I did my 2 years from there. And afterwards, I migrated to FMH and completed my med school from there. My plan was to do USMLEs from the very beginning, but my parents were of the view I cannot do that, so they forced me to do a house job, which was not a great idea. And I started my USMLE preparations kind of after house job. And I was also working as a demo part-time in medical education department at FMH. So I think USMLE preparation in whole took me around 2 years, more or less. And at that time, I was exposed to the psychiatry department at FMH, and I was also working part-time at an addiction clinic there. So that experience was very interesting. And I thought about, maybe I should consider going to psychiatry instead of medicine. And when I came to USA, I decided to do some rotations there. And I was doing some research work at Rush University in Chicago. And that kind of, laid down the foundation that, this is something I really like. This is more interesting. There's a lot of areas that kind of overlapped with, social issues, gender, psychedelics. So all those stuff is something that I really was interested in. And I also kind of enjoyed the overall work-life balance in psychiatry. So I thought, what, I should consider applying for psychiatry for the match. And the first match I applied, I couldn't match. I got 2 interviews. And I think the biggest reason was I didn't have good LORs. Most of my recommendation letter were from like private clinic psychiatrists. There were like a couple of letters from, from FMH or from Pakistan. So I felt that didn't further my resume, a lot of questions, a lot more research work. And just by doing these 2 things, research, publications, I felt that the next time I applied, I had like 10 interviews. And my LORs were improved a lot. They were all from university hospitals. And the overall, resume was it showed that I'm very dedicated towards psychiatry. So that kind of completely changed the picture. And then I matched at Rutgers, which is in New Jersey. I had a really great time there. I think the 3 mistakes that I made during that course, and I will highly recommend everyone not to do that, is if you're interested in applying for USMLE, as Abbas said, start preparing as early as possible. Like, I think you mentioned after like in the middle of 3rd year. Don't wait till your house job or after your house job, because preparation, that can take time for a lot of people. The second thing I would say, find mentors who are like 3-4 years ahead of you, who are in residency. Don't take advice from people who have not matched. They will just discourage you, to be honest. Find people who are in the journey, who have matched, who motivates you, who encourages you. It's not an impossible task. Frankly speaking, everyone I know who applied for USMLE sooner or later got matched. So it's completely doable. And the third thing is get involved in some sort of research work in your medical school. Like get involved as quickly as possible. Go to find faculty who is involved in research. I think that's super important. And try to publish as quickly as possible basic articles like editorials, opinion pieces, case reports. Start from there and build up your resume more and more in the respective specialty you're interested in. So those are like my 3 recommendations. And I will also say to explore kind of your interests, like what specialty fits your personality.
Did we lose Dr. Aadil? Or is it me just not seeing him?
No, I think he
I
got
think we did.
disconnected. Yeah.
Yeah, Eeman, can you get in connected with him that he got disconnected and he can
Sorry.
come back?
Can you hear me?
Yeah, we
can hear
can.
you.
So I'm just going to close by saying, try to explore other specialties and try to explore your interests as early as possible and see what sort of specialty best matches your personality, something that you can do in the long run. I will obviously highly encourage to consider psychiatry. It's a great specialty if you're interested in philosophy, social issues, gender, psychedelics, drugs, addiction. It has this wide area that you can do research on, you can see patients on, and with a great work-life balance. I'm literally working from home today. So
you're already selling your specialty, Dr. Aadil. Don't you think you're becoming a bit biased? And to be honest,
that is true.
I would just say something about psychiatry. It's becoming more competitive with coming years.
Oh yeah.
This year, I know a lot of IMGs could not match in psych because they didn't have one or the other thing, and most of the now AMGs are coming into psych too. So the competitiveness of a specialty also comes with who is applying where and how we are going to get through it. So hands down to you, Dr. Aadil, that you decided it in the wiser times that where do you want to go? Because that's one of the things that always like trickle down for me, especially because I am going in a combined medicine plus pediatrics specialty where I'll be doing internal medicine plus pediatrics. And I feel like I'll be like, it's a bit challenging, but I love both of those fields. And it was Dr. Aadil who said, hey, you should rank it the highest one rather than the other ones. Because for me, I would say that I was interested in internal medicine plus pediatrics. Did not apply into many programs for MedPeds because it's very competitive and they don't look at your CV. And I did email all of the programs where I applied, and most of them said that we have been filled or something like that. And I just had one interview for MedPeds, just one, where I matched. And for other, I applied in internal medicine and pediatrics. Pediatrics was not that much like highly thing that I really wanted to go in as a whole thing, but internal medicine, yes. And I did get interviews in internal medicine. They were more than 10. So yeah, so all of those internal medicine, and you're right, ranking your first program as MedPeds, and then you're praying, oh Allah Ta'ala, please make the best decision for me. So that was my journey. And Dr. Aadil has seen everything, all my rants, all my cries and everything. So hands down to him for his tolerance and for his all the patience, because he was all, you can do it, you can do it. That's also one of the things that I really, really want to back up out, that people really need to listen to each other. You should have a support system with you. Either it could be your senior, or your parents, or anybody. And whosoever is your support system throughout this journey, please be very much thankful to them, because they are the people who are tolerating you, all your mood swings and all the stuff that's going on. So Dr. Aadil, can you set us for rotations in US probably in future? That's the question. Oh, so you want him to be your mentor and you want to rotate with him? I think he'll be going as an attending in Jacoby and he could answer it
Oh,
after
yeah,
being there, but
for sure.
for sure.
Yeah,
That's
no,
one
I
of the
can.
huge thumbs up.
So I would be an assistant professor there. So if anyone is interested for rotation, I will be in psychiatry, but I will try my best. I think they have a medicine program to
Yeah,
see if it is possible. I will do my best to help for sure.
right. Great. That's a good thing, guys. You're getting an US clinical experience within this webinar. How easy to get US clinical experience. That's really a nightmare, to be honest, to get US clinical experience these days. And Dr. Al, thank you so much for being so kind to your juniors and your. I'll take some time to share something about unique about my journey. Like I know that we have talked about what is the ideal time for you giving step one or not, or like that, and starting preparation during third year, fourth year. I did an elective, rather not elective, an internship in University of Missouri, that's St. Louis, Missouri, during my med school. That was where I was introduced to USMLE as whole. Like I didn't know about USMLE until my third year. So if somebody would have asked me, oh, what is USMLE? I would be like, huh, what is that exactly? So after third year, rather fourth year, I applied for that internship. I did in neurology because I was very much interested in neurology at that time. I came to US, got exposure at St. Louis University. And I think that exposure gave me a bit glimpse of what my life could be in United States, what is medical system. And it's entirely different, to be honest, from what medical system you're seeing in Pakistan right now. The way you are seeing the patient, how your rounds are, how attendings or the professors deal with the patient, it's entirely different. It's more evidence-based. It's more like what the guidelines are all about, what is the things going on so far. So that's where I had a vision for USMLE and stuff. And then after my house job, I was like, I have to do it. It was more of my parents' thing rather than me. Like for other people, like Abbas was saying, so he was like, I can do it, or I'll be able to do it, or like stuff like that. But for me, it was my parents. Oh, you can do it. You can do it. We have seen you do multiple things in medical school, because as Eeman told you all about, if you've seen somebody in your class who is participating in every activity, who is a loudmouth, not a loudmouth in a bad sense, who is who is being doing a lot of stuff, doing research, doing co-curricular activities, debate, dramatics, sports, and stuff like that. And all of these things do help you in this whole journey too. Like for making up your CV, what are the ingredients that you need? I'll be talking about that. How much US clinical experience I had, I'll be talking about that. Why medicine and pediatrics combined and not internal medicine? Like I ranked med-peds as higher, and I'm happy with that. And which specialty you should be choosing, how you should be narrowing down, because I know somebody mentioned neurosurgery, somebody mentioned about other specialties they're interested in. Your interests are going to develop over the time. It's not like that. There will be few people who are very much focused, like somebody wants neurosurgery from the day one of your med school, they'll get neurosurgery if they're very much determined about it. I know there's one of the girls, I think she's from Zil-E-Ali Medical School, and she's doing neurosurgery fellowship right now. So she's doing a research fellowship right now, and she'll be applying this year math cycle for neurosurgery. And she's all over the place. Like she has all good connections, good papers, research papers, also clinical rotations in neurosurgery specifically. So yes, it is a good thing that your CV should be tailored towards it. But if you're lost and you do not know where you want to go, I think it's totally okay. So talking about some of the things that my resources, I'll just touch base these things very specifically for myself and a person who's not a very bright student. I do not categorize myself as bright student till now, because I have a tendency to make make connections in my mind, and I cannot cram or memorize stuff. So if something makes sense to me, I will be able to decipher it. if I am seeing a USMLE question, if it makes sense to me, I'll be able to answer it. If it does not, then I would have to sit back and reiterate or revise everything that's related to that. That's the way I study. I know it's different for other people. Like some people have like photogenic memory, like some people are very smart in memorizing and knowing the concepts easily, and they can like reproduce those concepts. I unfortunately have to repeat some stuff like that because for medicine was a very bit tricky thing for me. For step one, I think my journey also started around Abbas because Abbas started in 2020. I started in 2020 after my house job, like August or September 2020, and gave my exam in 2021 and then 2022. And the third step 3 also in 2022. The math cycle I applied 22 and 23. So step 1, I use first aid, Boards and Beyond, UWorld, YouTube. I would recommend highly about YouTube because it's a very good resource, to be honest. If you want to use YouTube into the best of your interest, you can, and you could like get out of a lot of stuff. Like there will be some people who would have given the concept, a very long concept, in 2 to 3 minutes videos, and that will you'll be able to decipher it, and you will be able to swallow it, and you'll be able to reproduce it also. And the other recommendation is Dr. Rahul Damania. He has all the videos that are free on YouTube. They're very good. I know about Anki and all those stuff, but I made my personal flashcards. I handwritten flashcards. One of my class fellow who also did step 1 at that time during the med school, he used to make those handwritten flashcards, and he used to revise them during our rounds, like the morning rounds and all the stuff that you do in your med school. He was very dedicated, and his dedication really motivated me to be dedicated during my step 1 journey and USMLE journey, because you need to be dedicated and disciplined. There's no shortcut to dedication and discipline. To be honest, there'll be times you would not be going to parties, you'll be not going to all of the stuff, but it's okay if you want to have another goal. I went to all the parties. I do not recommend not going to the parties. Have a fun life, have a friendship life like that. But when you're in a dedicated period, when you ever want to study and you want to achieve something, have it like with the full passion, not like aaj kar liya, kal nahi karna, kal kar lenge, parson kar liya. So this mindset does not work. I'm a kind of a person, you'll laugh at it. My whole study table was full of the quotes and motivational things, because I need to see things to motivate us. Like you're crying on your study table, oh my God, so many questions left for today, how I'm going to do it? And then you see, oh, you can do it. And then you carry on and you like start revising stuff. Pathoma, please listen to Pathoma during your med school. And once you're in your dedicated or the study period time of step 1, you'll revise it. It will be very much helpful. I used to make notes on my Pathoma while I was in 4th year. I think that helped me for revising it during my step 1 journey. So I didn't have a clear mind I'll be doing USMLE, but somehow I had used so many resources during my med school, like Kaplan for pharmacology. That's one of the things that my cousin recommended, and I did it at that time. Oh, Kaplan, and I would be able to understand pharmacology because I could not understand during my lectures in medical school. So that also helped me. So some of the resources which helped me in some subjects, I did utilize them. But do I recommend all of them for everyone? No. Boards and Beyond is very good for people who want to revise their whole concept of physiology, pharmacology, and like subject wise and the system wise. And first aid, for sure, I would want to do a one-on-one session for everyone for how to use first aid. I think Abbas, you can come on with that too, like how you use your first aid. That could be helpful, like thing. For me, first aid annotation was a bit hard thing, but I made sure I understood every concept in that book. And that is the key to success in step 1. If you know that one word, what is in in first aid, what does it mean in reality and how it will be questioned upon in your step 1 exam, that's how you're going to reach first aid. So know your concepts clearly. It's not like that you'll do 3 months UWorld and you'll be like, oh my God, you're the king and princess of the like queen of the USMLE step 1 and you'll be able to pass it. You'll be able to pass it if you know all those concepts, you know how to reproduce them, how to use them, and that's the key to success in that exam. Obviously, questions, questions, questions. I did, I think, first pass of UWorld, and then did half pass of the UWorld, and then sat an exam with giving all the NBMEs. So that's what I remember of USMLE step 1. Step 2, yes, it should be concise. I just used UWorld and a bit of Abbas library because there were some concepts that I really wanted to clarity upon, or I think management plans that needs to be. I did use Divine podcast, but that was only during my gym or my walk session, not like daily, or I was very much disciplined towards it. And the third thing is I'm a person who do group studies rather than an individual learner. So I do not know how you guys are a good what kind of learning opportunity you have. So I used to have study partners along. They could make you, they could break you. So choose your study partners very wisely. And I would recommend if they're in the same timeline as you, like we would discuss questions or we would solve questions together. So 2 minds could work more wonders at times, but not recommended for everyone. USMLE step 3, I did it during my rotations. I was doing my last rotation for internal medicine, I think pulmonology rotation in United States at one of the programs. And during all those my rotations, like I started my rotations again in 2022 after giving my USMLE step 2. And for those 6-7 months, I was doing 6 months rather. I was doing rotation and preparation for USMLE step 3 rather. And within a month of preparation, I gave my USMLE step 3. Do I recommend it? I'm not sure. I passed it. Yes, I did. But it's up to you. Now everything is getting score, and everybody is crazy about the score. So you should know where you stand, and you're the best judge of yourself throughout the journey. There's some of the questions I want to address. I think other panelists can chime in too if they want to talk about those questions. Before starting your USMLE journey, I would say you should ask your question why you want to do USMLE. Why USMLE? Are you really, really passionate about healthcare in United States, where you could see another way of dealing with medicine? Yeah, it's evidence-based. It's a lot of resources that you have, but are you really ready for that? If you are, the answer is yes. Good. Then what is your timeline? What should be your timeline? Like somebody asked me in the chat, oh, if I give it after 4th year, would that be good? So I was attending a webinar because I love to attend webinars of different medical schools. So there was a webinar in King Edward, and they recommended their students to do it after their final year, like start preparation after 4th year, do final year, and after final year, those 3 months before house job, you should be able to give your step 1 within that and do your house job if you want to. If you don't want to, within the next 6-7 months, you should be able to do step CK. So that's how the Al Khan people do. Like they take 1 year gap year, they complete their 5 years of med school, they do their electives during med school. And after doing their final year, they do step 1 and step 2 within a year. So that's also I think that's also a very fair timeline too. But if you can show your dedication during your 4th year medical school, you can learn your concepts in 3rd year medical schools and 4th year medical school. Why not? What is ideal time for rotations? I would highly recommend electives, and I and Eeman have been talking about VSLO. That's one of my target for FMH is that we should be registered with that. And if we get into registration, there are very good medical schools that you can do electives at. Bit expensive sometimes, but worth it. Yes, because if you make a good connection means that your preceptor or the attending, like if some of you will be rotating with Dr. Aadil, do you think Dr. Aadil will be giving letter of recommendation same to everyone? No, he would be looking at you as a student. What is your learning ability? How are you dealing with the patient? How are you behaving? And he'll be giving a personalized letter of recommendation. And that connection does matter because your letter of recommendations are open during your interviews and people see what people are writing about you. So it's not like that you can take every opportunity as, oh, I just did it with my one of the alumni, he'll write good things about me. It does not work like that. So the other thing, where to go for guidance? For guidance, I would always say, look around people who are in the same journey, like Abbas said, Dr. Aadil said, like look for the guidance people who are like immediate seniors or 3 years into it. Like we would be good help for people who will be applying for next math cycle or the 26 math cycle. But after this, I think 27, 28 will be more senior, and we might have time, we might not have time. So it does matter with people, it vary from people to people, and you can have your own resources, because every one of us, like Dr. Aadil, Dr. Abbas, and me, we didn't have like structured guidance for us. So we want to conduct these webinars. I might be connecting with other alumni too. There's one of the I think associate professor in cardiology. She's also an FMHite, and she is working in Gezenger. If she could come up and speak about her journey, I think that will be also motivating for everyone. Like she's a cardiologist and she's a female, so female cardiologist from FMH, from the one of the pioneers badges. So why not? And how to when to do USMLE preparation, give exam, that has been discussed a lot. How to build good CV. That's a lot of questions that I've came across during my inbox after my math cycle also. So as I mentioned, I was a not trouble student, I would say a student who was always in some of the societies. That really helped me to write down everything, what I really helped and did in my societies. And it really worked. I was not like people do filling the paper for the sake of filling the paper. But I know Dr. Aadil showed me his CV where he had also worked with so many organizations, and we used to work. That was because it's my passion to work and volunteer. So there was a lot of things that were in my CV, like starting the Humans of FMH Society, for example. I'll give. So I explained what was my role, what I did. Like for Eeman, she can talk about this CHRS, if I'm pronouncing it the right way. So she could talk about this research forum. I did mention this research forum because I was connected with it in my CV also, and also about your US clinical experience. It could be university based. It could be your I would say clinical, like clinics based or anything, but the letter of recommendation does weigh. So I had some university LORs. I didn't have some university LORs, but it was an amalgam of both. And what is importance of medical school performance, both academically and co-curricular for USMLE? Yes, this is a very valid point, I would say. Your academic performance does matter. You could mention your distinctions, your merits, or your honors in your CV. And they will be coming in your medical school performance evaluation, MSPE, that will be like given from your school. And the other thing I would say, my co-curricular activities were highlighted in my MSPE. So don't take it like for granted that you're doing something. Like Eeman could give these all pointers to the at the end to the principal or something, that these are the things that I did in my medical school. Can you highlight them in my MSP or SEL or anything that you're getting from your medical school? And if that is highlighted from your medical school, it does matter. It does value. I was asked about my debates, dramatics, my research, my paintings, whatever I mentioned in my CV, it was asked. And you should be passionate about it, and you should be very much honest about it. So that does weigh on in your CV. Last few points, what is the total cost of the journey? I think Abbas did a very good thread on Twitter about it. I think he talked about the journey is costly. You're already paying the med school a lot of stuff, and then you have to do USMLE. I financed myself in the last year and something. So I've been financing myself also because I work in research right now. I'm a clinical research specialist at East Carolina University, where I'm matched. So some of the skills that you gain over the years, they can be profitable, and you can work in different roles. Like some of my friends work as a research fellow. I was given an opportunity to work as a research fellow at Harvard, but I could not take it because I had to do finances and stuff like that. So do yourself, know how to sell yourself. That's a very good thing. If you know how to sell yourself, you'll get good rotations, you'll get good mentors, you'll get good things in your CV tailored down, because you need to know how to sell yourself. You do not need to undersell yourself. That's very much important. Like Dr. Aadil is in Yale, and I'm sure in fellowship, everything would be highlighted in his CV, and he would be selling himself very high at that time. And I'm sure in Jacobi, they are taking him as assistant professor, and that's his preference like that. But still, this is one of the things that you need to learn, is just how to sell yourself, how to do networking. I would want Dr. Adil to address that, how to do networking, because he was the one who was guiding me. Make LinkedIn profile, make this, make that, how to do networking at US, how to get US clinical experience and stuff like that. Dr. Adil, can you talk about that?
Oh, thank you. I think you are the expert on this, but I think the best way forward should be having a good social media presence. I think it's becoming vital now that you should be on Twitter, LinkedIn. You should show your face to as many attendings and faculty and researchers as much as possible. Participate in events like, webinars. When you're in America, you can participate in community events, grand rounds, just so you can meet more, faculty and researchers. The other thing is, I think someone put in the chat as well, you can just email a faculty that you want to work with, or you think is inspiring and can be a good mentor, and just tell them, this is the area that I want to build my resume on, and how can you help me on that? Vast majority of the academics really like it when students reach out to them and they want to help them. My experience has been the same. Like I didn't know anyone at Rush University, and I emailed 3 or 4 people in the faculty who were doing mindfulness-based therapies. And I mentioned that, that's something I'm interested in. And they just invited me the next week. So I had an interview and they offered me like a volunteer research position. So social media and email as many faculty members as you want who can inspire you and help you.
For social media and stuff like that, I would just mention my experience. It has been tremendously good. Like I reached out to a few people on Twitter. Like there was one of the residents in Yale, I think, and she reviewed my CV for me and my PS. And I think I will be thankful for her also for the whole time, because my CV and my personal statements was reviewed by more than 10 people, probably. Most of the people I highly regarded for my PS. One of them is already in the webinar, Dr. Aadil, because by the end, the day he said, oh, your PS looks perfect. That was the day I was satisfied. I was like, okay, cool, I'm done. I don't want to do further anything. Yeah, networking does help you. For me, somewhere in LinkedIn, I did reach out to few people, and they were kind enough to review my CV and stuff like that. And the things they pointed out at their own way is entirely different than what you are doing in your med school and your home country. And then for me, because I'm working right now currently in a research position, so I think the research way you can work and collaborate with as many as people you want to do for research. You can email a Harvard faculty or anyone, and or anyone you are interested in. Like I emailed a professor in one of the universities for a research position, because I read one of the articles. I was studying for something and I just read that article I was interested in, and I got an opportunity to talk to them about it. This also helps you in your interview skills, because you're meeting more people, you're talking to more people, you're understanding how to answer the question and how to channelize your thoughts, and all things help you as a whole as a person. Be humble throughout the journey, be resilient, and be hard worker throughout the journey. And after USMLE, what to expect during USMLE and after USMLE? It's a long journey, to be honest. There are going to be ups and downs. There are going to be good days and bad days. You need to revamp yourself every day. and how to choose a specialty. I think Dr. Aadil really talked about it in a very beautiful manner. Like, you should be talking about your interest, and you should be knowing what your interest is. Like Eeman was talking me about, like, she wants to do surgery probably, and probably she wants to switch into another specialty. I came into medical school for doing surgery too, but after doing my house job, I was like, no, surgery is not for me. I'm not a person who can stand there and have this much dedication. And apply and interview preparation. I don't know why there's no preparation, no over here. But yeah, after USMLE, you'll be expected to complete your CV, fill it in ERAS, and that's a whole thing. But for now, at your level, I would recommend do USMLE, have a dedicated time for yourself, know why you want to do USMLE, look for opportunities of like electives or US clinical experience during your med school, because the connection you'll make during med school, you mean like you will be standing out in your CV if you have something during your med school. Like I was talked about my neurology rotation also during my internal medicine interview. Like, why did you do neurology? Why did you write a paper on neurology and like that? And I told them why. You should have the answers of why. If you have something, though I wasn't applying in neurology, and I was very much evident from my CV that I had more experience in internal medicine, more clinical experience in that, and pediatrics also I had few experience. So yeah, and last thing about the social media thing. Yes, I was quite active on social media. One thing that helped me during my interviews was that many of the applicants knew me. So when we were discussing in a separate room, everybody was pointing at, oh, I've seen you on Twitter like that. And one of the program directors, he literally mentioned, I'm not going to name him, but he literally mentioned, oh, do you think your social media presence does not count? It does. So have a positive mindset, a positive way to explain yourself. What is your passion about medicine on social media? I think that can be highlighted. And go to the Twitter spaces like Match Madness or Apna. Apna is like Pakistani, American origin Pakistani association in America, North America. So that's also a very good association to be associated with during your after your USMLE and during your math cycle. A lot of stuff. Any question, Eeman, that's in the chat that you want us to answer?
I think we've covered all of the questions during the session. And I think if you want to share your email addresses, you could do that in the chat as well, so that if anyone has any questions later on, they can contact you and get in touch. And you will also be having a few more sessions in the future. As Dr. Mariam mentioned, we can have a session on, how to annotate first aid, how to go about the resources that they've talked about in much detail. So Dr. Mariam has shared her email address. I think she would be happy to answer any questions that you guys might have. And
Yeah,
we've covered everything.
Dr. Abbas and Dr. Aadil, you can share your email ID if they can reach you out over there. What did you mention up beside up now? The Twitter spaces. The Twitter spaces are like this webinars or something that they hold for IMGs or also for AMGs, American medical graduates. And you should be having a connecting system. Like if you can add me on LinkedIn also. You can direct message me on LinkedIn also. Dr. Aadil is also on LinkedIn. I'm not sure about Abbas. Are you on LinkedIn?
Yeah, I am on LinkedIn as of recent.
So yeah, you can connect with us about that. How to do our research as in research papers and stuff like that. I think Eeman and you guys have a very good platform like the CHRS for research. For me, I utilized my community medicine papers that we got published. Also, I did collaborative work with Dr. Aadil, Dr. Asan, and some of the other faculty. And right now, I'm also writing 2 research papers with the residents of the program that I'm going to into, because I used to attend the grand rounds and ask them questions if they have any paper they want to write about. So collaboration is one of the key to learn research, because not everybody would be a good writer, not everybody could be a good analysis or good at stats. So know your strengths, and so yeah. I think we are done for today. And anybody have any question, you can ask us, email us, and you can be in touch with us. And I would want a forum for us in Eeman in future, like if we got connected with other attendings of FMH, so we could have a way that you guys can have clinical opportunities at United States, and you guys can come and rotate with your mentors or your seniors from med school. That's what my goal is. Like in future, we should not be looking at other medical schools. We should be looking at our alumni for collaboration, for help and guidance. And like Dr. Aadil has been very kind for me to give his time, and other people like Dr. Khurram, he could not make today. He was also very good and helpful throughout my journey. So always remember, people, always be humble, be respectful, and be kind. That is the way you will be able to get most out of most people. Okay. Thank you so much from my side. Any ending remarks from anybody else?
I just want to say thank you everyone for joining in, and also a special thank you to Eeman for organizing all of this stuff and for taking the time. Yeah.
Well done, Eeman. Thank you. Abbas?
Yeah, thank you so much for having me, guys. Thank you to Eeman, Dr. Aadil, Dr. Mariam, and everyone else who attended. I really wanted to organize something like this, and I'm glad this took place. And I hope I see a lot of future FMH graduates in the US in the future, inshallah.
Thank you so much, Dr. Mariam, Dr. Aadil, and Dr. Abbas for joining us today. We will inshallah be staying in touch and we'll have sessions in the future as well. And thank you to everyone who joined us today. That is all from our side. Thank you and good night. Allah Hafiz.